Hello there, my name is Sulthan Falah with a student ID number of 2510-9112-10062. So here I will be explaining the definition of hunger. So what is actually the definition of hunger itself? So my explanation would be the feeling of hunger itself is the feeling of discomfort which caused by the lack of food that we consume, and it usually accompanied with the desire to eat. So, is it always bad? The answer is no. Because if we rationalize the amount of hunger we had and the period of time that we're having the feeling of hunger isn't too excessive, then it would bring more benefits instead of harm if we were doing it in careful ways. It could help with losing weight and the other stuff which related to our metabolism, which will be explained by my friend Risty Ramadhani.
Hi, I'm the next one, Risty Ramadhani, with student ID number 251091112003, and I want to talk about a benefit from short period of hunger. The first benefit is memory enhancement. Exposure to hunger triggers the retrieval of food-related memories, which are influenced by learning association between sensory cues and food rewards. The second benefit is self-regulation in eating. Short period of hunger can help control food intake by improving the body's ability to distinguish between true needs and eating habits, which ultimately support healthier eating patterns. The third benefit is autophagy. Short-term fasting is associated with autophagy, whereby the body cleanses and repairs itself by breaking down and removing dysfunctional cells and proteins, which may contribute to improved health and longevity. The fourth benefit is boosting metabolism because the body tends to increase fat burning during fasting. The fifth benefit is improving insulin sensitivity because it can help prevent type 2 diabetes. The sixth benefit is about brain health. Short-term fasting increases ketone production, which acts as an energy source for the brain, helping to improve concentration and focus. The last benefit is reduction in inflammation. It can reduce inflammation levels in the body, which is associated with many chronic diseases.
Now let's look at the scientific evidence. Is short-term hunger actually effective? But before we start, let me introduce myself. My name is Abdan Hakim, with student ID number 25109112100026. First, let's talk about metabolism. We look at the studies on type 2 diabetes patients. The results are significant. Fasting lower blood sugar by 4.08 mg per dl and improves insulin sensitivity, as shown by the HOMA ER score dropping to 3.23. And the best part, unlike normal diet, when you lose muscle, here muscle mass actually increased by almost 1 kilogram. But the most surprisingly fact is about body weight. Usually, when people diet, they lose muscle, but here the data shows that while fat decrease, muscle mass actually increased by 0.98 kg. This proves that short hunger burns fat, not muscle. Next, this is the most powerful mechanism. It's called autophagy. This happens when you fast for 24 hours. The body activates pathway called AMPK to clean out damaged cells and repair itself. 2024 Umbrella reviews confirm this with high certainty. Next, for our heart and brain, research show that short hunger lowers both LDL cholesterol and blood pressure, which protect your heart. For the brain, hunger produces ketones. This is a clean fuel that improves your focus. It also boosts BDNF, a protein that helps your memory. It even reduces inflammation in the body, keeping us healthier. So biologically, hunger is a signal for the body to heal itself. Thank you, that's all for me.
Hi everyone, my name is Qarin Nabilah, so I wanna tell you how to practice short fasting safely. First, start gradually. If you are new to short fasting, don't begin with a full 16-hour fast. You can start with a shorter period such as 8 hours so your body can adapt. Second, stay well hydrated. During the fasting, drink enough water, herbal tea, or the other calorie-free foods to prevent dehydration, which can worsen side effects like dizziness or fatigue. Third, choose nutritious food when breaking the fast. Avoid heavy or high-fat meals that burden digestion. Focus on food rich in protein, healthy fats, and fibers such as vegetables, nuts, fish, or lean meat to maintain stable energy. Fourth, listen to your body. Pay attention to how your body responds. If you feel tired, dizzy, or uncomfortable, stop fasting and eat immediately. Don't force yourself as everyone reacts differently. Fifth, avoid fasting for too long. Do not fast longer than 24 hours without medical supervision, as extended fasting might cause nutrient imbalance or slow metabolism. 6. Consult a doctor or nutritionist if you have medical conditions such as diabetes, health problem, or eating disorder. If you are pregnant, breastfeeding, or have serious health issues, seek medical approval before fasting. Bye-bye.
So next, we're gonna discuss about the potential risks of short period of hunger. Before we start, let me introduce myself. My name is Neyla Shazia with student ID 2510911320028. Okay, let's start. While short periods of hunger are widely discussed for their potential health benefits, it's also important to also consider the possible risks. During the initial phase, the body may experience decreased energy levels as it adapts to reduced food intake. This can lead to symptoms such as dizziness, weakness, fatigue, or difficulty concentrating, particularly when individuals do not consume enough fluids or balanced nutrients during the eating period. Short period of hunger may also have a negative effect on individuals with certain medical conditions. For example, people with eating disorders may experience worsening of unhealthy eating behavior, while those digestive disorder or diabetes may face increased symptoms or unstable blood glucose level. Furthermore, if fasting is practiced for an extended duration or without proper planning, it may cause metabolic disturbance. The body may respond by lowering metabolic rate as a protective mechanism, which can reduce the efficiency of calorie burning. Over time, irregular eating patterns may result in deficiency of essential vitamin and mineral. These deficiencies can weaken the immune system, negatively affect bone health, and disrupt hormonal balance. Therefore, although short periods of hunger may offer certain benefits, they should be practiced continuously and gradually. Adequate hydration, balanced nutrition, and awareness of the body signal are essential. For individuals with underlying health condition or those who are new to fasting, consultation with a healthcare professional or nutritionist is strongly recommended to ensure safety and effectiveness. That's all for me. Okay.
Let me introduce myself. My name is Nasyrah Elvira with student ID number 25109112005. Here I will summarize the material presented by my friend, namely short-term starvation has various benefits such as improved memory, regulation, eating patterns, autophagy, increased metabolism, insulin sensitivity, brain health, and reduced inflammation. However, this method is not stable for everyone. Take quite slowly, stay hydrated, catch nutritious food, and always listen to your body response. For individuals with special conditions such as diabetes, eating disorders, pregnancy, or breastfeeding, consultation with healthcare professional is highly recommended. The primary goals of short-term starvation is to support a healthy lifestyle, not to overexert the body. With a self-approach, this method can be a beneficial practice for health. That's all from me. Any shortcoming or excess, please forgive me. Thank you.